Now we will present to you our journey from interoperability to usability with the DH Convener. This is where we left off, with the paths laid out between different platforms and servers. Now we will show how this data from FHIR and other platforms can be used for primary and secondary purposes by patients, healthcare professionals, and researchers. We conducted a literature review and expert interviews to identify needs, challenges, opportunities, and risks for each patient-generated health data persona. The patient persona has 3 wishes that he can address to a software intervention that concerns his health data: protection from overwhelm and anxiety, transparency and safety regarding privacy concerns, and an intuitive and personalized interface that offers guidance and support. Patients ideally learn about the DH Convener via trusted channels such as their healthcare professional or official state websites, then download their application to their phone. The dashboard lets patients record data and manage sharing with healthcare professionals or research. The recording of the data can happen, for example, with a QR code. The app collects basic profile info and pre-selects relevant data. Advanced users can expand options to select additional categories. Now the dashboard shows the key values and longitudinal data. Patients select their healthcare professional and follow a guided process. Pre-selected values are explained but adjustable. Data can be shared anonymously for research, commercially, non-commercially, or for specific projects. Patients review and accept GDPR terms in easy FAQs and verify identity via an official domain to securely access EHR and research server. In the resulting dashboard, the status can be reviewed and adapted as wished. Now let's turn to the clinician persona. 3 of the clinician's most important needs in a patient-generated health data intervention are sufficient information about the patient's condition and measurement methods, support in estimating the patient's condition based on multiple indicators and factors, and help with effectively managing and coaching patients. In the ideal scenario, the clinician has the DH Convener software seamlessly integrated into his patient data management system. From the patient's mobile device, which we explored earlier, the clinician receives an invitation to connect the DH Convener add-on. After accepting, they can immediately access the patient's data. The interface of the add-on allows switching between different timelines and viewing modes. If additional context is needed, the clinician can analyze the patient's device and review the AI-based decision support system. If more details are required, the clinician can request additional available data categories or even pose personalized questions. Finally, let's look at the researcher persona. Similar to the clinician, the researcher values access to comprehensive and reliable information to meet the requirements of specific research questions and protocols. Additionally, this user group would particularly benefit from data assessment and evaluation, as well as from the integration of legal and ethical safeguards throughout the process. Here we focus on the process in which the researcher applies for access to certain data categories. She selects a cohort, including demographic criteria and chronic conditions, followed by the data type, either qualitative or quantitative, coming from patient devices or surveys, and the corresponding platforms, FHIR and more. Next, she specifies the desired variables. And in the summary view, she can immediately see how many observations and participants would be theoretically available for her selection. Once satisfied, the researcher submits the data request. After the hosting site reviews and confirms eligibility, she receives access to the dataset via email or a secure data transfer channel.